Good morning, Dr. Kentish-Barnes. Good morning, Professor Azoulay. Sabine Beauvallet, Marketing Business Partner at GE Healthcare, and I'm happy to welcome you this morning on this EasyChem Live TV. So, Dr. Kentish-Barnes, you are PhD in sociology, part of the Famirea Research Group in the Intensive Care Unit Hospital, teaching hospital in Paris, Saint-Louis Hospital. And you are also the author of several dedicated books dedicated to family and patient experience in the ICU. Professor Elie Azoulay, you are professor in medicines, head of the ICU in Saint-Louis Hospital. And you are also acting president of the European Society of Intensive Care Medicine. And you are both leading an exciting project to detect, prevent, and mitigate post-traumatic stress disorder in family members having a loved one in the ICU. And this project is called FAME, an acronym for Family Members Experience in the ICU. So this project, it brings together 80 ICUs in France, and also with a multidisciplinary team, including psychiatrists, psychologists, sociologists, nurses, intensivists, and also data scientists, and many others. And GE Healthcare is a partner, the industrial partner of this consortium, which is including academic and non-academic universities, hospitals, and also major universities and research organizations in France. So, Professor Azoulay, could you please explain what FAME project is and what are the objectives and the various components of this project?
Thank you very much. The FAME project is actually sponsored and held on behalf of the Paris Cité University. They are holding us. And with Nancy and Frédéric Pochard together, we applied for a project that at the same time tries to understand better how we can personalize PTSD management in family members of ICU patients. Personalized means that we are guiding our strategies based on risk stratification models that are issued from clinical studies. And we underwent a clinical study including 1,356 family members in all the group that you mentioned. And we are going to work also to predict, using algorithms and machine learning, PTSD in family members of ICU patients. So this is towards a better understanding and recognizing those at risk. At the same time, Nancy has undergone a very large initiative to develop materials that she will describe. And these materials are really directed to help assist and improve the experience of family members.
Thank you. And Nancy, what can we expect for the family with this project, and which are the tools have been already developed part of this project?
Yes, so as Elie said, the idea of this project is to improve the family's experience and to prevent post-traumatic stress disorder. So we have developed a certain amount of tools to help families navigate the ICU. The idea is to present a diversity of tools because we know that some families are more responsive to written documents, others to animated videos. There's a problem with my microphone. But I continue. I think it's working now. Yeah. So as I was saying, so we're developing a variety of tools because different families are responsive to different tools. So we have developed a series of written documents which include an ICU welcome leaflet to help the families navigate the ICU, as well as different cartoons that will help families understand the ICU environment, the words that are used, and to help them also find their place and their role with and for the patient. And in end-of-life situations, we've also developed an end-of-life booklet, which is both, I think, very sensitive and very down-to-earth to better respond to the family's needs, and once again, another cartoon for end-of-life. But we've also developed animated videos to, once again, help the families navigate the ICU and understand the environment, as well as virtual reality programs. So families will be able to use virtual reality headsets and better understand the environment, how they can play a role in the ICU, and also a program to help families relax during the ICU stay. So these tools are all going to be assessed in the randomized control trial to see if they do impact on families' understanding and satisfaction, but more importantly, do they help prevent post-traumatic stress? And we're also developing other tools that won't be assessed, but will be available for family members at the end of the project, which is a chatbot to help families navigate administrative procedures, to help them understand and get general information about the ICU, as well as a hotline that families can call 5 days a week to help them answer their different questions. So that's just an example of the tools we're developing at the moment. And of course, the last tool is going to be developed with General Electric, which is the automatic health bulletins that will be sent from the electronic health record to the family members on the FAME platform. But we're discussing at the moment the content of these health bulletins and also the rhythm, when we're going to send them, who's going to send them, etc.
So already many tools already developed.
Yes.
Mm-hmm. Thank you. So Professor Azoulay, why is the industrial partnership important in this project, and what are the expectations from the clinicians in this domain?
Well, that's a very good question, because usually most of the academic projects are relying on academic financial, and this research doesn't include industrial partners. However, this one, the RHU, the hospital university research, are mandatory associated with a partner. So the project includes, so it is research for us, but we also need to develop the pipeline and create activity and business for the industrial partners. Let me phrase you how I see that at a clinical and a researcher level. A lot can be done on our own to develop, to assess, to evaluate, and even sometimes to say that we have maybe taken the wrong way to address this. And it happened over the past that some of our interventions did not result in what we expected. With industrial partners, we are looking more on developing an environment, a technological environment. We are more looking forward to see how we can get from the bedside to family members. And this is something we could not do on our own. We need to collaborate for that. Collaborating also with industrial partners means a lot in terms of what we can learn for your functioning that is very different than the hospital functioning. Mm-hmm. More than that, elements of language. You speak an industrial language that we need to understand, because the future of clinical research and research overall has to be based on a collaboration between academics and industrials.
Yes.
Let me tell you more. We have GE Healthcare as the main and the only industrial partner, but we also have service providers. And this is very different, because we are going to share the intellectual property of FAME with GE Healthcare, where we are going to use the service of other providers. And this is also very different.
Thank you. And Dr. Kentish-Barnes, FAME is a project being funded by the French National Research Agency. But what is your vision about FAME at the European level?
Yes, well, I think that the idea behind these projects that are financed by the French National Agency for Research is that the knowledge that we've acquired during these 5 years can then be extended to other settings, different backgrounds, different contexts, so that it can benefit a maximum of patients or family members and improve the healthcare system. So I think that if the tools we developed are positive, if the randomized control trial does show that they can help family members, then we should think about maybe translating these tools, adapting them to different cultural contexts. For this, obviously, we'll need funding and maybe the help of the European Society, but it's definitely something that we should think about. And the other way to answer your question, I think, also is that we're developing a university diploma in France for ICU clinicians working in the ICU to help improve family-centered care. But we're also going to develop a massive online open course, which will be in English. And so we're hoping to attract a maximum of other clinicians, European or even worldwide, who can improve family-centered care in the ICU. So maybe, Elie, you want to add something?
I think that you said everything, Nancy. I just want to emphasize exactly the same points. This is from patients and family members to patients and family members. Our dream, our hope, is that it can serve a larger number of patient and family members everywhere in the world, and of course everywhere in Europe. With Nancy, Carole Boulanger, and Christina Jones, we have set up a group within ESICM that is called the Vital Group, and that emphasizes this particular interest for family-centeredness of care, for patient-centered care, and for also working on how we can better convince and work with healthcare professionals to make them assist family members better. So, yes, Europe, yes, international, and Nancy already works with other groups that are not in Europe, that are in the United States. She just conducted a trial with, on behalf of the late Randy Curtis, and this trial is now also done in the United States, and we are really connected to each other.
Good. Thank you. And Professor Azoulay, behind FAME project participants, what the plan to make all hospitals and the ICU organization in Europe aware of such actions?
Let us be honest. I'm working on that since more than 30 years. People are aware. People work on that. I'm very impressed by every single nurse, young doctor, a nurse assistant, maybe more senior people, on how they deliver a care that is also centered on patient and family members. I would say that they don't need to be more aware. They need to be helped. Let's be clear. If you want to assist patient and family members better, so you need to have an ICU organization that allows you to do that. And I'm making a call to every decision maker, every policy maker, that we need to recognize and maybe to value more the work that is already done at the bedside by nurses and doctors in our ICUs.
I understand. Okay, and is there some initiatives run by the European Society of Intensive Care Medicine around this topic at this time?
Yes, there are many. So we spoke about the Vital Group, and with Nancy, Carole, and Christina, yesterday or 2 days ago on Saturday, we did a webinar that is called Voices, and that gives the spot to ICU survivors, their family members, and their healthcare professionals. I must say that it was amazing. We learned a lot, and I don't see how in the future we could work without being guided by patients and by family members. And we are also conducting a randomized control trial that is called HELLO, that is based on positive psychology, just to incite everyone to look at the right part of the word that is positive.
Okay. So a lot of good initiatives around
Plenty.
this project.
Plenty.
Yes. Would you like to add anything else regarding FAME?
Yeah, I would like to say that we are very privileged to have been selected in such a very, very difficult project, because there were many wonderful projects who applied, and very few were selected, so we were very privileged. We are also very privileged to be working with the Paris Cité University, because they are very professional, and we rely on their structure to make open markets, to call people, to to do a lot of things. So this is also a privilege. And another thing is that FAME is covered until 2027. And with Nancy, we are already working on the future of FAME that maybe can involve industrial partners.
Yes, of course. We hope, hopefully. So more to come on this wonderful project. Yes. Thank you, Dr. Kentish-Barnes, and thank you, Professor Azoulay.
Thank you.